Okay, can we come back together again as a group of the whole, please? So we're going to do our last round of report outs, and it's the only thing standing between us and lunch. So thank you in advance for being as inspired as you are hungry. And we'll start for number 7. Table 7.
So Radical Table 7 came up with the following, that we were going to make one intervention which triggered a decentralization of power away from the traditional academic educational power bases by having the boards and the advisory committees to the academic center, to the teaching hospitals, have to be like the FQHCs. At least 51% have to be consumers of our resources. And by doing that, it changes the power balance so that we have to become very aware of those who are frightened about making decisions for academic centers because they're going to have to learn about it, to demystify the terms we use, the distance we create from our communities so that we keep power and don't share our budgetary issues and where we're investing our dollars. And we think it would create a terrific learning environment for all the things that were said before by changing the power balance.
Oh, great, thank you. Table 6.
Maybe to follow on that, we focused on the financial model and said that has got to move the dollars to the new ways in which we're teaching. That means into the community, to the patients, to the other faculty. And the last comment we had was, if we're asking people to address the upstream determinants, why did they get into the hospital in the first place? Some of those dollars have to go in that direction. You can't just come in and bomb on a community and say this is what's going on and expect a change. We have some obligation to be ready to address these issues financially as well.
Ready?
Great.
Okay.
Ready? Deb? Yes.
Thanks. So we crafted a value statement, and our statement is health literacy and the educational process is an essential element to improve social cohesion, cohesion based on solidarity, equity, compassion, and caring for others. The impact is improved health and wellness, and health is the state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity.
Wow, great. I don't want to follow that act, but I'm going to. So we talked about actually broadening the base of competency by the inclusion of others. And we thought that had many tentacles that could have reached out into various aspects and various roles. And we also talked about the utilization of resources, how we could add value to the education enterprise and to the community by having utilized our resources better and also having, through these new roles, expanding the base of resources. So, great. Table 3.
Thank you. In regards to a value to community, we thought that the comment from the first round from Table 7 about not using community is key, and that by engaging with communities, we can move the system from a focus on reducing disease to a focus on improving wellness around issues such as food, transportation, the built environment, and the diversity of the health workforce. In terms of, I will say, impact instead of value necessarily to the educational process, we talked a lot about the fact that these changes are going to require and drive changes in leadership, educational governance, and accreditation processes.
Great.
Okay, she looks at me with apprehension. I'll just add a few words to the mix because we agreed with what everybody has said already. But what we haven't heard that we said, people-centered, drop the deficit model of people as dependent and needy, and maybe that approach would realign systems, same thing's already been said, and perhaps think of it as a public good.
Go ahead, Beth.
Okay. Embracing that the new educators of the future will include those that were mentioned, quality professionals,
people in communities, peers, learners themselves directing their education, learning how knowledge workers, teaching us how to work with knowledge, system engineers. The ultimate value to the community is a healthier community. The impact on the educational process is significant, and we need a DNAR order because we can't tinker around the edges. We just got to let the old die and accept that the new ones have to be designed in different ways, that we heard good examples from New Mexico and the ones that were presented and Professor Campos's example. But ultimately, it's about true partnerships where there is power and influence vested in the community, which means a reduction in the control of the academic setting.
Great. Well, I think it's wonderful and useful to sometimes make the value propositions articulated in a clear way, and there were many of them shared and created around this room, so thank you. Patricia, is there anything else that you need to say before lunch? Enjoy the food. Thanks.